Hello ladies and gentlemen, and welcome back for more Let's Play Trauma Center Second Opinion. In the last episode we did chapter 2-3, Striving for Asclepius. In this episode we'll be doing 2-4, Awakening. So let's go ahead and get it started. That concludes our meeting. Please review the information again on your own. We should just move on to the surgical conference now to save time. Those doctors involved, please stick around. We're starting, Doctor. Dr. Stiles, pay attention! Huh? What? Oh, sorry. I guess I didn't hear you. Is everything alright? You've been staring at that x-ray for a long time. I was just going over today's operation again in my mind. Anyway, let's get the conference started, huh? He's been spacing out a lot lately. At least he's concentrating hard on something, I guess. Mario Kovac, 66.1 inches, 158 pounds. Multiple aneurysms have formed on the surface of the large intestine. Requires sedative treatment and suturing of affected vessels. Today's patient is Mr. Kovac, who was carried in this morning. He's currently not doing very well. Tests showed a number of aneurysms near his large intestine. Some of them have ruptured, and there is a risk of anemia. We need to perform a laparotomy and get those aneurysms under control. The objective of this operation is treat the aneurysms on the outer membrane of the patient's large intestine. That should be all. First, inject a sedative into the swollen vessel to reduce its size. Excise the problem area and suture the vessel closed. You'll need to use magnification again to ensure your accuracy. Derek, concentrate on the patient. Don't worry about anything else. Okay.
Let's begin the operation.
Alright, so let's get it started. I don't remember if I think this is the first time we've ever done aneurysms. So we'll be introduced to that and the new sedative today. The antihypertensive is in effect, but the aneurysm could still burst. We need to hurry, Dr. Stiles. So like always, just disinfect it and use the cut. Make the cut. Not use the cut. Use the scalpel.
Doctor!
That lump on that vessel is the aneurysm. Try magnifying that area. We're treating the artery, so be careful. Let's try to avoid a rupture. Inject the sedative into the aneurysm. So we have to inject that orange stuff into there, cut around it,
Now's your chance.
and pull it out.
Doctor.
Just like a tumor. We have to reconnect the vessels that were cut, but there's a lot of blood in the way. Drain the blood first.
Then forceps.
You have to drain the blood, perform the anastomosis. So, yes, reading medical words is really hard for me.
Good work.
The aneurysm's been treated. We can finally relax. Let's close them up now. Cease magnification. And as soon as you do, wait a little bit, and boom, another one appears. What? Again? Every vessel in the area is in danger of becoming an aneurysm. Continue the operation. We'll just have to treat them all. Yep. So this one is just like the other one, just as easy. They'll get a little bit more difficult here. I think later on, I actually one winds up bursting on me, but that's about the only one. So anyway, again, go out and you'll see there's two more here. So go ahead and just do them both at the same time. There you go, and cut it. And cut that one. Oh, nope, the sedative wore off, so you have to. And I used the wrong thing, like a moron. There we go, and cut it. And there we go, just pull it off, and there. Pull that one. Again, you can just go through the same process. This is pretty easy. It's just when there's multiple of them, like there will be in a minute, that's when it becomes difficult. Right now, there's just two more again. So it will become a lot more difficult, and in a little bit we'll see something else pop up, and not in this surgery, but in other surgeries we'll see some interesting things pop up that actually perform the basis of this game that we're playing here. So yeah, I messed up that one. Good work. I think it's settled down for the time being. We should wait a moment to be safe before we close them up.
This isn't good.
And there's 4 over there, so to make this easy,
Maybe your
just zoom in and, like she said, use the healing touch. There we go.
In there.
Alright, and just go ahead. Right now, one's about to burst on me. I think it's, yeah, that one right there on the right. So, we'll take care of that in a moment after we inject the sedative into the rest of them and remove them. Go ahead and do that. There we go. So, let's go ahead and remove them all. And other ones, you'll have to be really quick, which some of them will take me a while, especially when we get to the more harder ones. But anyway, let's go ahead and do that. I messed that one up again. And there we go. Right at the last second. Was that the healing touch? It's incredible, but at the same time, it's a little frightening. If every doctor had that ability, what would the medical world be like? I'm sorry, let's close them up. Alright, so go ahead and close them up like normal. And of course the bandage. And we're done.
Nice work,
Another
Dr. Styles.
operation complete. Great work, Dr. Styles. Great. So there we go. Let's see what we get. We get a C ranking. So I understand you figured out how to use the healing touch. Make sure you don't rely on it too much. You need to develop your basic skills too. Huh? What the? I know it won't be easy, but you just didn't take this job because everything's going black. Derek, are you even listening? Derek, what's wrong? Not good. Alright, so we're going to go ahead and continue this by doing 2-5, paying the price. So let's go ahead and let's get it started. Forget about that power. But are you prepared for the pain that would bring you? I became a doctor so that I could help people. And if it costs you your life, you give up your own happiness? I don't know, but I do know that people need my help. And I want to help them. Where am I? It's the ceiling. What am I doing here? Dr. Styles! Angie, what happened? After Mr. Kovac's surgery, you just collapsed. You've been asleep for 3 days. Jesus Christ, that's long time. What? 3 days? What about my patients? I have operations scheduled. Already taken care of, Derek. I called in the other doctors. But that's in the past. We need to discuss how you're going to proceed from here. Okay. Derek, I forbid you from using the healing touch like that. But why would you? That ability puts a tremendous amount of physical strain on your body. It's too risky. What if you collapse in the middle of a procedure? But without my healing touch, Mr. Kovac might have died. Exactly. That's why you mustn't abandon the healing touch. I'd advise you to only use it when absolutely necessary. After all, you shouldn't be relying solely on the healing touch anyway. Developing your natural skills as a surgeon is far more important. We can't assume the healing touch is the only reason Kovac survived. If you want to help people, then focus on strengthening your natural abilities. I understand. Take it slowly. I'm sure the power inside you will find its way out. Become the best surgeon you can, and one day you'll inherit the full heritage of Asclepius. Yes, sir. So, there we go. Next time we will do 2-6. Just let me die. So until then, thank you for watching, everybody, and have a great day.